Cancer-associated thrombosis is a common complication with patients with advanced malignancy. So it affects quality of life and mortality in these patients. So advanced pancreatic cancer has one of the highest incidences, approaching 15 to 25%. So because we don't understand why patients with advanced cancer are prone to thrombosis is why we're studying the UPR, or the unfolded protein response. So what is the UPR? So the UPR is an integrated intracellular signaling pathway that is initiated by 3 ER receptors in response to accumulation of unfolded and misfolded protein in the ER lumen. So the UPR has been associated with malignant transformation, but whether or not the UPR contributes to cancer-associated thrombosis has not yet been studied. So it's what we're looking at. Our main objective is to test the hypothesis that the unfolded protein response contributes to cancer-associated thrombosis. So our design, we are using pancreatic cancer cell line, we induce the UPR, we collect the media, and we evaluate for prothrombotic extracellular vesicles, which I'm gonna call EVs. We look to see if this prothrombotic EVs had thrombin generation potential. We looked on the surface of these cells. When you induce the UPR, they are prothrombotic proteins that are expressed more on these cells compared to control. And we also took the plasma, the baseline plasma of patients with advanced pancreatic cancer, and we did some proteomic analysis on them to see if the patients in our cohorts, because after 2 months, some patients did develop VTE and others didn't. So we wanted to see, okay, patients that developed VTE, do they have an increased expression of UPR markers compared to patients who didn't? The first findings is that when you induce the UPR in pancreatic cancer cells, these cells actually spit out prothrombotic extracellular vesicles. We also found that this prothrombotic EVs they augmented thrombin generation. We also found that on the surface of these cells, when you induce the UPR, there's an increased expression of prothrombotic protein, particularly tissue factor. And in our patient cohort, we also discovered that patients who actually went on to develop venous thromboembolism, is what I've been calling VTE, had increased expression of UPR markers in their plasma. There's still a lot of work that needs to be done, but our findings supports our hypothesis, which is that the unfolded protein response contributes to cancer-associated thrombosis, particularly pancreatic cancer-associated thrombosis. Because our experiments has been in vitro based. I can't necessarily say we have limitations in our studies because there's still a lot of work that needs to be done. We're looking to do more in vivo studies using mouse models. We also would like to confirm our proteomic findings that patient in fact that develop VTE express higher UPR markers. So we're looking to have a larger patient cohort for that study.